The Pregnancycare Show is proudly brought to you by
Floridish Formula,
Spretonic.
Minor disorders of pregnancy are a series of commonly experienced symptoms related to the effect of pregnancy hormones and the consequences of the enlargement of the uterus as the baby grows during the journey of pregnancy. During this phase, most women suffer inconvenient but not life-threatening symptoms, and this is referred to as minor disorders in pregnancy. Though minor, sometimes may become more serious as a signal for a serious underlying health problem that need a referral to the health facility. How then can I cope and manage with these disorders? During pregnancy, the rapidly rising hormones of pregnancy like the prolactin, progesterone, and estrogen have effect on the maternal body to sustain the pregnancy for the 9-month journey. But then again, these hormones also cause some symptoms in the mother known as minor disorders in pregnancy. These aren't really serious and somehow could be managed from home. On today's episode, we'll be looking at what minor disorders are in pregnancy. Also remember, it varies from woman to woman, and also even in each pregnancy, it varies as well. Welcome to the show. The show is the Pregnancycare Show, and my name is Dede. So for today's episode, we have with us a very beautiful midwife who has been working for so many years. So she's going to take us through today's episode on the minor disorders of pregnancy. Hello, you're welcome to the Pregnancycare Show.
Thank you, Auntie Dede.
Pregnancycare Show is very grateful to have you for our episode today. So for the sake of our viewers, we want to know your name and what you do.
My name is Deborah Boateng, a midwife at 37 Military Hospital, and then part of the pregnancy school.
Okay, so we have Auntie Deborah with us today, and she's a midwife. She's been working for so long, and then she's going to give us every detail of minor disorders in pregnancy. We'll go for a short commercial break. When we come back, the show still continues.
Floridish Formula is a liquid herbal iron extract with the benefits of organic iron 3 polymaltose plus vitamin C and other B-complex vitamins, the base of fruit juices and yeast. Floridish Formula helps increase your energy level, stamina, and highly nutritional, and also reduces tiredness and fatigue. It contains vitamin B1, B2, B6, B12, and C. Floridish Formula helps keep the family smart, healthy, and strong. For enquiries, contact Unicom Chemist Limited on 0302 324 595 or 0302 324 383. You can also email unicomchemist@yahoo.com or visit www.unicomchemist.com. This advert is FDA approved.
Welcome back. If you just joined, it's still the Pregnancycare, and on today's episode, we are looking at minor disorders in pregnancy. So, Auntie Debbie, when you're talking of minor disorders in pregnancy, what does that mean? What are those disorders?
When we say minor disorders of pregnancy, all that we want to say is there are some discomforts that come about as a result of the effect of hormones on the pregnancy. So these are something that comes in because of the hormones that are at work. And you know, when one is pregnant, it's those hormones that help the pregnancy to sustain and to go on. And as these hormones, their levels increase, certain disorders or certain minor symptoms comes in.
So what is the actual cause? Is it just the hormones or there are other external factors to it?
We can say that it is the hormones that cause these minor disorders, mainly the effect of progesterone, estrogen, and then prolactin at work. They cause these hormones. You know, these hormones come in to prepare the bed, that is the uterus for the baby. And as it's preparing the bed, sometimes certain symptoms accompany the hormones. And that is what sometimes comes out as minor disorders or discomfort in pregnancy.
So what are some of the most common ones that we have?
The most common ones that we have, sometimes even when we are having our menses, it comes in, like nausea and vomiting, something like craving for food, something like pica, that is taking in things which are not nutritious or which are not food substances, sometimes like cramps in the leg or lower abdominal pain. All these things are minor disorders in pregnancy.
Okay, so we are going to take them one by one, as you've mentioned. So we are going to try to look at how a pregnant woman can deal with that, how she can cope, and even how to manage with it. So we are starting with the nausea and vomiting. What will you tell our viewers about that? How can they cope? How can they manage with that? And how serious could that get to?
When we take nausea and vomiting, what actually happens is because of the effect of the hormone on the pregnancy. So this can easily be managed at home. In fact, as a pregnant woman, you have to know yourself. Maybe let's say if the vomiting is in the morning, during maybe when you are pasting, then you have to change your style of pasting. Let's say you can paste in the evening, and then in the morning you can use some mouthwash to wash your mouth so that it goes off. But if it is common with you during the day or throughout the day, then you can just put in something like a little ginger or maybe a little cinnamon, the cinnamon piece into your mouth. All these things help to reduce the symptoms of nausea and vomiting in pregnancy.
Okay. A woman who throws out everything she's taking, would you advise that she visit the hospital, or she should still stay at home and say she's managing it?
No, when you are throwing out everything, then you need to come to the hospital. It means the name has changed from just the normal nausea and vomiting to something else. And that is what we midwives term it as hyperemesis gravidarum. It means nothing can be contained in your tummy, and it is not good for your unborn baby, because if you are not eating, it means you don't get nutrition for this baby, and you yourself also will be weak because you will not get enough nutrition for yourself. And so if you are throwing out so much, then you need to come to the hospital. You don't need to stay at home.
So when you are throwing out so much, you need to come to the hospital. Do not stay at home and say you are managing it. Try and visit your doctor or your midwife. Our next is heartburns. What should we know about heartburns, and how do we manage heartburns?
You know, heartburns is a common condition in pregnancy, and this normally comes about as a result of the growing fetus. You know, as the fetus is growing, the uterus push up a little, and so it pushes the stomach up a little. And also the pregnant hormone, like progesterone, it softens some of the muscles in the body. And so as a result, it makes the sphincters a little soft or weak. And so when you eat anything like pepper, oily food, spicy food, it sometimes come up. And when these things come up, it's very uncomfortable because it causes what? Burns in your chest. And so if you're a pregnant woman and you're experiencing any of these things, you can take maybe something like a dry biscuit, you can take a little milk, and then in the evenings especially, you shouldn't eat a lot of greasy and oily food or food that is have a lot of pepper in it. Because when you eat this food and you lie down, because when you lie down, the uterus pushes the stomach a little up, it sends all these things into your chest, and you may be having a lot of heartburns. And so if you're having a lot of heartburns also, you can support yourself a little in bed with pillows, and then drink a lot of cold water, not chilled water, but cold water. A little of maybe milk can help. And also if it is severe, you can take a little antacid, but that need to be prescribed by your midwife or your doctor. So if your heartburns are so severe and you cannot bear it, please don't stay at home. Come to the hospital, meet your midwife, meet your doctor, who will help you manage it. But if it is minor, with a little maybe milk or a little cold water, then you can manage it at home.
What of constipation?
Constipation is one of the minor disorders, and what actually comes about is the effect of progesterone. As I said earlier on, it lowered some of these muscles and intestines. And so as a result, the food that we eat, they stay longer in the large intestines.
Okay.
And water is absorbed in the large intestines. So when water is absorbed from the food that we have taken, it means that the person is going to have a little what? Constipation. And then also because of the weight of the uterus, it causes a little pressure on things that are coming up. And so because of that, sometimes pregnant women get constipation. How do we manage this constipation? Pregnant women need to eat a lot of food with fiber or roughage, and then should take in a lot of vegetables and fruits, and then should drink a lot of water. It's good for them, especially in the morning. If you can drink some lukewarm water, it helps a lot. And also when you have the urge to go to the washroom, don't say you are waiting, just go, so that at least if it is a little, it will come out and then you'll be free. Because as the constipation increases or worsens, it means the pregnant woman can't get something like hemorrhoids, piles, because of the constipation. And so if you are having constipation and then you realize you cannot manage it at home, 4 days, 5 days, you are still not passing stools, you are eating all right, then you need to come to the hospital. But in most cases, when you take just roughage, a lot of water, a lot of fruit and vegetables, it's worse off.
Okay, so we are moving to cravings and aversions. There are some people in pregnancy, they crave a lot for so many things, either nutritious or non-nutritious diet. Some also do not want to eat certain things. So how do you manage your diet? Because I know that eating too much too could make your baby bigger, and that is another, maybe another complication somewhere. So how would you advise somebody who is craving too much? Should that person keep eating, or how do you manage that?
You see, when you are just eating, then we need to know what type of food you are eating.
Okay.
Because it's very important. Some of the things you keep on eating can be nutritious.
Okay.
Others cannot also be any other thing. Let's say a pregnant woman who is just taking in clay, pieces of wood, charcoal, and other things. He's eating, but it's not nutritious.
Okay.
It doesn't help the baby in any way. Some also crave for food. Okay, so what type of food is the pregnant woman taking? Is it a nutritious food, or maybe he takes, let's say, I want to eat banku, I don't want the pepper, I don't want the stew, I don't want anything, just the banku that I want.
Okay.
Maybe I'll eat it like that with water because of pregnancy. Realize that it's not good enough because it's only carbohydrates you are taking in. And so such a person needs to take in other things, so that at least he can get fat and oil, he can get protein, he can get vitamin to support herself and the growing baby. And so if you are craving for things, at least you should talk to your midwife, so that at least we know exactly what you are craving for.
It's not everything they should eat. You need to check if it's nutritious or not nutritious. So, okay, this is something that I'm chipping in. Some people say pregnant women shouldn't drink Milo, they shouldn't take milk, pineapple, certain foods. Do you, apart from maybe coffee, alcohol, oily, spicy, pepper food, do we have any food that a pregnant woman shouldn't eat at all?
Depending on the person, let's say something like alcohol will affect your baby. When you are craving for cigarettes, it will affect your baby. When you are craving for maybe the energy drinks, sometimes they affect babies. But when you are craving for sometimes a lot of food with sugar, realize that you are putting in a lot of carbohydrates, it will affect the baby. But when you are craving for maybe a normal diet, then that is why I'm saying that you need to see your midwife. When you realize that you are craving for something so much, and if it's not there, you don't feel comfortable, you can't eat anything, sometimes you need to talk to your midwife, so that at least the midwife will help you select the best food to eat. Because if you are craving for cigarette, alcohol, it will not help you, it will not help your baby. And so we should know what type of food you are craving for.
How comfortable should sleep be for a pregnant woman? Is there any right position for a pregnant woman to sleep? Because some complain of, I'm not able to sleep, I don't know how I should sleep. How do we deal with that?
And that one we call it insomnia, or difficulty in sleeping, which happen with some pregnant women. What actually happens is sometimes it depends on the position the person is sleeping. You know, in pregnancy, sometimes when they come to the antenatal, they have the notion that you should always lie at your left lateral. Even though that is the good position, you should know what is comfortable for the person. Some when they support themselves with pillows, they are okay. Some, when they lie left lateral, they are okay. Others also, when they lie with a little support, they are okay. Like the left side with supported with pillows. Okay. Because now we have pregnant pillows. Yeah. They are okay. But when the person is lying on the tummy, you realize that it will not help much, because when you lie on your tummy, you will not be comfortable. And then when you lie on your back flat, also you will not be comfortable. So sometimes we have to know the position in which, when you lie, you are not comfortable. And then we advise you on that, so that you can assume a position that you yourself feel comfortable, so that you can sleep small. Also, one thing that we realize that is causing insomnia is sometimes when we eat late in the night. Okay. It means we're having a lot of food coming up, giving us heartburns, and so you don't sleep well. So if maybe you realize that it's the heartburn that is causing the insomnia, then you have to eat a little early. And then in the evenings, you don't have to take in anything like greasy food, any hot pepper, nothing, so that at least in the night you can sleep well. So you yourself have to assume the position that you think you are comfortable in, so that you can sleep well. There is no special position for pregnant women. Okay. Let's say maybe when you sleep at this side or that side, because what will be comfortable to me may not be comfortable to another person. But we should know that the position that we are using will not cause harm to us and the baby.
Okay, so those are some of the minor disorders our midwife here has told us about. She said even though they are minor, they can also aggravate into major concern. Let's hit the street to find out what our viewers have for us on today's episode.
My name is Mamide. Is it okay or good to be taking local herbs in pregnancy? They say it's good for babies.
My name is Mrs. Priscilla Akumeni. I'm speaking from Dansuma Market. Please, I want to ask, how can I do to reduce spitting in pregnancy?
Hello, my name is Christabel. I'm talking from La Paz. And my question is, if I don't experience any of this disorder in pregnancy, am I fine or normal?
So those were some comments and questions from our viewers from the street, and our midwife will be helping us to answer each and every one of them. So Auntie Debbie, one of our viewers would want to know, how can she reduce spitting in pregnancy? That is her problem.
That is her problem. Then she have to know what actually causes the excessive spitting in that person. Maybe if it is a result of some scent or some body perfume, then you have to stop it. Or maybe some area that you live in, maybe the scent around, then you have to move away. But there are some that you cannot do anything about, so you need to manage it. Maybe having some small, maybe container with a small disinfectant, and then when it come around, you put it inside. Then continuous mouthwash also help. So once a while, you can wash your mouth so that at least you not get this continuously.
Okay. So our next guy is asking, is it okay to take local preparations or herbs during pregnancy, because she believes that it makes your baby or your unborn baby stronger?
This local preparations and herbs, sometimes we don't know their sources. Sometimes they are ear-hearing sources. Even though they are good herbalists who help with pregnancy, they have herbs that help with pregnancy. What I would say is, if you don't know the source, don't just take it, because everybody is different. Everybody's blood type, the makeup is different from each person. Sometimes somebody will tell you that I have taken this enema, this drug, this herb, so that at least my delivery will be fast. But rather, the person will turn out maybe having ruptured uterus or excessive bleeding or excessive contraction during labor. But whilst the initial person didn't experience any of this. So we are individuals. So what I would advise is, actually herbs, how much are you taking? What is the quantity, the amount are you taking? And so we need to be very careful when it comes to herbs. But if you know the reliable source where you are taking it from, then I cannot say you shouldn't, because some says it's very helpful to them.
Oh, okay. So what are some of the complications of these minor disorders, either on the mother or the baby? Do they have any of such complications?
Yes, with the mother, let's say something like vomiting. Mother will not get enough, baby will also not get enough. Severe waist pain can be as a result of a problem which can cause miscarriages and abortion in some people, and sometimes to something like craving for pica, craving for things which are not nutritious, can also not help the mother and will also not help the baby. Constipation can also cause hemorrhoids. If you are having excessive constipation, you can have hemorrhoids. And so all these things, that is why I say any of the condition that you cannot manage at home, maybe day 1, day 2, you need to report to your midwife. That is why now we are having focus antenatal, that you can talk to your midwife, your doctor, anytime that you have a little concern.
Okay, so do these things resolve after birth?
Yes, most of them result after birth because the hormones that were working, their levels has reduced. And so this nausea, vomiting, constipation, pica, they all sometimes go down after delivery of your baby.
So coming to the male partners, how supportive should they be during this phase?
What I would say is, I will not say male partners for now. There's so much things about gender.
Okay.
So what I would say is partners should support their wives when it comes to this minor disorders. Let's say I'm craving for something. You realize it's nutritious, and then I may need it because that is the only food I can eat. Then you have to help me get it. I have a friend who stays at Kaswa, and the husband has to drive all the way from Kaswa to Osu to just buy wache for that person. It's because the person thinks that is what she can take in and cannot take anything in. Like the waist pain, your partner can help by rubbing it, supporting you with other pillows. Maybe if the pillows are only 2 on the bed, he can volunteer and give you his pillow as well, so that at least he supports you, then you become comfortable and can sleep at night. Let's say maybe you are in bed, you want a little water to drink. Your partner can help you get the water for you, so that at least you also can rest more, because pregnancy comes with so many things. The hormones activity alone sometimes puts stress and burden on women. And then, so the partner needs to be supportive. He needs to understand that the woman is not faking, or the woman is not doing it intentionally, but he's doing it as a result of the hormones. So she needs to be there for the woman. And after pregnancy, most of these things wear off, and then he will not even see it again. There are few people sometimes, even they are annoyed with their husband during pregnancy, or they fight with them. They should know their characters of their women before pregnancy and during pregnancy, and then after delivery, all these things goes off. And so this minor disorders goes off after pregnancy.
Okay. So I was asking that because most of the men think the women are faking it. Probably that you are staying here, you want to buy watches somewhere fast. So probably that's why I'm asking how the men could deal with that. Even coming to the mood swing, most women are so offensive during pregnancy. So I think that there are lots of education that the men should get. Do you have them come over for antenatal school?
Yes, we have some men coming over for antenatal school, because when you come, you understand your wife better, and then you can also help your partner when it comes to certain decision making, because you are there, you listen to everything, you know what is going on, you know when to get her things ready for labor, you know some of the complications of labor, you know some of the things that goes on during labor, and so you can help and support your wife more. And so we encourage the men or the partners to come to the antenatal clinic or follow their wives to clinic when they are going, so that sometimes they can help them when there are anything that the women maybe forget or need to know.
Okay. So just know that the women are not faking it. Those are some effects of the pregnancy hormone. So try to be there and be supportive. Let's go for a short commercial. Because we come back, the show still continues.
Hey, what's up? Yo, Kojo, you look happy and strong.
Yeah, Charlie. But I couldn't have done it without you, you know. Madam was always complaining. But ever since you introduced me to Spetonic, life has been good.
Spetonic helps boost the immune system, fitness level, and performance. A tablet a day is all you need, babe.
Spetonic, strong as a wood. For inquiries, contact Unicom Chemist Limited on 0302 324595 or 0302 324383. Email info@unicomchemist.com.
Spretonic is not suitable for persons under 18. This advert is FDA approved.
Welcome back. Now today we want to take your final words. We want you to look into the camera and speak to our pregnant women and their partners about minor disorders in pregnancy.
Okay, what we are saying is that minor disorders are common in most pregnancies, and then they come about as a result of hormone. And this minor disorders will go off after delivery. And so when they come about, husbands, partners, mothers, people that the pregnant woman is staying with or supporting should bear with the person. And then we should also help them so that they can go through this without any stress. And also when the partner, husband, mother observe that maybe these disorders are getting out of hand, they should rush to the hospital, meet their midwife, meet their doctor, so that it can be addressed well. We are expecting that every pregnant woman will go through this with ease and be able to deliver a healthy baby for the nation. Thank you all pregnant women, and we are expecting you. We are there for you to take care of you. Thank you.
Thank you for coming on our show. We are grateful to have you on the Pregnancycare show. We are looking forward to having you more on our show because I believe that my viewers and myself, we've learned a lot for today. So thank you so much for coming on our show.
Thank you.
Okay, so we are going to look at some tips on how to manage minor disorders in pregnancy. So you're encouraged to eat in bits, small quantities, but frequently to reduce nausea and vomiting. Avoid eating spicy, oily and greasy foods to manage nausea and vomiting as well. Avoid wearing high heels to prevent muscle pain and waist pains, and also limit wearing of too fitting dresses. Keep your surroundings neat and tidy to minimize nausea and vomiting. Avoid lying down, bending and stooping just after eating to reduce nausea and vomiting. For those who experience much nausea and vomiting, consider drinking some mild ginger drinks, mint or cinnamon tea during the day or even before meals. Taking more fluids, more fruit and vegetables to mild constipation. Drink or sip some amount of milk to calm acid in cases of regular heartburns. Cultivate regular practice of your personal hygiene care, especially oral hygiene. Always find a suitable sleeping position of your choice and comfort. You can minimize most of these disorders during pregnancy with advice on diet, exercise, and simple home remedies that are known to be safe. Speak to your doctor or your midwife. Thank you for watching today's episode. So on today's episode, we looked at what minor disorders were, and we've learned a lot that some of these disorders could actually be managed at home. But then when it becomes uncomfortable for you, try to visit your doctor or your midwife. Do not take things that are not nutritious. And I know you know things that are not nutritious. So speak to your doctor, speak to your midwife at any time you wish to. Thank you for watching today's episode. Kindly follow us on all our social media platforms and keep subscribing to our YouTube channel at The Pregnancycare Show. Leave in your comments and then we'll attend to them as well. You can follow me on my personal IG page at @dede_gao. The show is The Pregnancycare Show, and thank you for watching today's episode. See you next week.